Good night, everyone. Welcome to my channel. The question tonight is what happens after an incomplete or failed DNC. We are gonna start with the procedure itself. So with a failed DNC, what happens is the machine, like vacuum machine, we'll call it vacuum machine, that is inserted. Okay, this is wrong. The vacuum machine is not inserted. A straw attached to the vacuum machine is inserted, right? That straw is supposed to take off the lining of the uterus and crush up the sac and the fetus, or depending on which stage it is at, crush up that thing and suck it through the straw into a little vase jar attached to the machine, and then that gets washed down the drain. With an incomplete or failed one, things get crushed and sucked out, but because the individual doing it is not able to see where the tube is going, so you're not attached to the ultrasound machine for them to be able, and there's no camera attached to the thing, so they're not able to see inside there anymore to say, okay, well, I got this thing right. They're not able to see. They kind of just winging it, just push the tube up inside and pray to God that they get the whole thing. So then they ask you, after that whole ordeal, to do a second ultrasound to determine whether or not the procedure was successful. So when you do the second ultrasound, they say, okay, well, everything is now clear. Seem like we miss a little bit of, I don't know, head or tail. So they have to go back in and do some more suctioning to take out the rest of whatever is inside of there, and then I don't know, whatever the practitioner normally does, I guess maybe medicine or whatever. So that covers that. In the event that it was successful, the second ultrasound will just show it would show a clear uterus, because that's where the image that shows up on the screen of the ultrasound machine, that's what it's showing inside there. In my case, the fetus and the sac was still visible on the second ultrasound, so it was not successful, it was not complete. And in a situation like that, the advice that is given to the patient is to monitor themselves for a period of 2 months. So when you get back home, you monitor yourself to make sure that you're not getting a fever or an infection or anything like that, and you wait for your body to naturally pass whatever is remaining, and that can take up to 2 months to happen, is what I was told. In that period of time, I'm not too sure about the pain levels and what to expect and what not to expect. In my situation, it was an unexpected procedure, so it was extremely painful because there was no anesthetic or anything like that to numb the pain. Otherwise, I guess I would have become suspicious at that point in time. I had a prior C-section. So, if you've ever had a C-section or know anybody who had one, it dulls the nerves in that area, so it makes it very uncomfortable, and it causes the pain to reflect in a different place. If you ever had a keloid really and truly is a growing cut, is what I think people just call it, or growing flesh on a cut. You see, if you feel it, it feels kind of numb, like you don't really have much feelings or anything. That is the way a C-section cut will feel on your lower abdomen. So I think it's the body that just does that naturally to let you know that something in that general area paining, so it would cause a different part of you to hurt. If you understand, you understand. This is the furthest I could go with this explanation here. So pain wise, I would say on a 1 to 10 scale, you should probably expect it to go from 5 to 12, because it would just, in certain cases, and depending on your pre-existing conditions, your level of sensitivity and your pain tolerance level, it could be a nightmare. Or I think it depends on how young you might be too, your age, and how fast your body heals. It could have a lot to say about that. At this point in time, the major thing for a situation where you feel like something unjust was done to you, maintaining your sanity should be a priority. Bouncing back to your regular levels of energy and eating properly should be priority. After all the thanks and praise for the fact that you survived something like that. What else did I plan on mentioning in this video? Let's see. Partners. If you live with your partner or your family members or anybody who might know about what happened, sometimes it's better to just give people a personal space, because everybody have a way of dealing and coping with things differently. So it's better to leave everybody with the Most High and leave yourself with the Most High too, so that He could do what He doing to them on you. Get some rest. It is important to sleep a lot, because around the time that you're sleeping is when your body gets in time to heal and focus really and truly on just healing and not all of the other things that you might normally be distracted by. So I hope this video finds you well, and if you happen to be in this unfortunate situation, it's gonna get better by the grace of God. Shalom.